Hi everyone. In this section we are going to see about Ostomy Care. I am Brinda Ronika, tutor working at M College of Nursing. Objectives of this section. At the end of the class, students will be able to define ostomy, enlist the purpose of ostomy, list down the indications of ostomy, enumerate the types of ostomy, explain ostomy care, describe ostomy irrigation, and discuss ostomy diet. What does ostomy means? It is a surgical procedure where an opening is created on the surface of the abdomen, allowing bodily waste such as urine or stool to be diverted out of the body. This procedure typically necessary when the normal excretory functions are impaired due to disease, injury or birth defect. What is stoma? Which means portion of the bowel or ureter that is surgically open and brought out through the abdominal wall. A healthy stoma is shiny, moist and red. So these are all the some of the examples for some stoma. One is flesh, next butted and inverted stoma. Next we'll move into the purpose of ostomy. First one is divert waste. It redirects the flow of stool or urine away from a diseased or damaged portion of the intestine or urinary tract. And the second one is it relieves obstruction. Bypass a blockage in the intestine or urinary tract to restore the flow of waste. And the third purpose is protect the intestine. Allow a damaged or diseased portion of the intestine to rest and heal. And the next purpose is it prevents infection. Divert waste away from an infected area to promote healing and prevent further infection. And the next purpose is it improves the quality of life. It enables individuals with intestinal or urinary disorders to manage their condition and improve their overall quality of life. Next, indications of ostomy. The first indication is cancer, colorectal, bladder or other cancer that requires surgical removal of a portion of the intestine or urinary tract. And the next indication is inflammatory bowel disease, IBD. The conditions like Crohn's disease or ulcerative colitis that cause chronic inflammation and damage to the intestine. Third, diverticulitis, a severe or recurrent infection in the diverticulum that requires surgical removal of a portion of the intestine. Next, trauma or injury, severe injury to the intestine or urinary tract that requires surgical diversion. Next, some of the congenital disease conditions like birth defects like spina bifida or imperforate anus that require surgical creation of an ostomy. And the next one is a neurogenic bladder. That is conditions like spinal cord injury or multiple sclerosis that cause loss of bladder control. And next one is a fecal incontinence, severe or chronic fecal incontinence that is unresponsive to other treatments, means we can go with the ostomy. Then intestinal obstruction, that is blockage of the intestine due to scar tissue, hernia or other condition. It may be temporary or permanent also. So these are all the some of the indications of ostomy, which includes cancer, inflammatory bowel disease, diverticulitis and perforated diverticulum, trauma or injury, congenital conditions, neurogenic bladder, fecal incontinence and intestinal obstruction. Next we'll move into the types of ostomy. So first it's divided according to the location. According to the location, colostomy, ileostomy, jejunostomy, cecostomy and urostomy. So first one is a colostomy. Colostomy means it is a surgical opening in the large intestine to divert stool. The colostomy also have types according to the location, that is ascending colostomy, descending colostomy, sigmoid colostomy and transverse colostomy. Next one is a ileostomy. So here the surgical opening in the small intestine to divert stool. So in the ileostomy, another one thing it is there, that is called as cock pouch. Cock pouch means that is nothing but it is a continent ileostomy, which is differentiated from the traditional ileostomy. Next one is a urostomy, means surgical opening to divert urine from the bladder. So this is according to the locations. These are all the types it is there: colostomy, ileostomy, urostomy, jejunostomy. And next, according to the type of intestinal stoma, there are three types it is there. First one is a loop ostomy, second one is a end ostomy, and third one is a double barrel ostomy. So what is loop ostomy means? It is a temporary ostomy created by bringing a loop of intestine to the surface of the abdomen. And end ostomy means it is a permanent ostomy created by bringing the end of the intestine to the surface of the abdomen. And third one is a double barrel ostomy. Here a surgical opening in which two separate stomas are created for the intestine. So this is according to the type of intestinal stoma. And next one is types according to the duration. There are two types it is there. One is a permanent ostomy and temporary ostomy. Permanent ostomy means lifelong the patient needs to be there with the ostomy stoma. Temporary means for a month only. So these are all the types of ostomy according to the location, according to the intestinal stoma, and according to the duration. Next we'll see ostomy pouch. There is a specific pouch that is available for ostomy. So that is the pouch. There are three types of pouch it is there. That is one piece pouch, two piece pouch, and two piece adhesive pouch. So in that one main thing it is there, that is ostomy pouch wafer. That is means it is nothing but it is a skin barrier, it is the piece of the pouching system that sticks to your body. So these are about the ostomy types and ostomy pouch. Next we'll move into the important part, that is ostomy care. So first, what is a pre-operative care as a nurse we should give means psychological preparation, because the ostomy that changes the body image. So psychological and emotional support, that is very much needed, very much important. So first, emotional support for alter body image, the loss of control over elimination and the orders. And next pre-operative care is a selection of site, a flat crease free surface in the patient visual field and within the rectus muscle. A flat site create a good seal and avoid leakage from the back. So usually in the right lower quadrant about 2 inches below the waist, that is a proper site, and marking of the area before the surgery. And as a nurse, our important role is a preoperative teaching, provide thorough understanding of the surgery, management of drainage from the stoma we have to teach, the nature of the drainage we have to teach, and care of skin surface and ostomy. And the important thing we have to teach about the ostomy diet, and also bowel preparation we have to do, that is emptying the bowel before the surgery by giving enema, and we have to maintain the NPO, nil per oral status. So this is about the preoperative care. Next we'll move into the postoperative care. So that is we have to assess the stoma color, edema and bleeding, and we have to provide appropriate pouching system and managing skin and ostomy care. Further, every day we have to give the ostomy care, and we have to do colostomy and ileostomy irrigation. And the main thing, managing dietary and fluid needs and encouraging for yearly ambulation. So this is about preoperative and postoperative care. Next, specifically we'll see about colostomy care. So what is the purpose of colostomy care means? To maintain integrity of stoma and peristomal skin, to prevent infection, to promote general comfort and positive self-image to the patient, to provide clean ostomy pouch for fecal evacuation, to reduce odor from overuse of old pouch. So what are all the articles required for colostomy care means? Clean tray containing Macintosh with draw sheet, kidney tray, pair of clean gloves, colostomy bag, normal saline or basin with warm tap water, gauze pieces, gauze pad or tissue paper, skin barrier, stoma measuring guide, scissors and bedpan. Next we'll move into the procedure. First we have to provide privacy for the patient and we have to wash the hands. Then we have to place a waterproof pad or Macintosh under the client to protect bed linen. Next we have to empty the contents of the ostomy bag before removing the bag, and then in the bag we have to note the color, volume, consistency and order of the feces. Then we have to gently remove the skin barrier and bag while supporting the client's skin. Next we have to place a gauze pad over the exposed stoma to prevent soiling from leakage, and wash the skin around stoma with warm water. We should not use soap and all. And then we have to thoroughly rinse the area with water and pat it dry. Then we have to note the color, moisture and protrusion of the stoma and the condition of the surrounding skin. If there is any differentiation it is there in the stoma means we have to immediately report to the doctor. Then use a stoma measuring guide to cut the wafer into desired size, because it should be fit perfectly, otherwise that is also causes the complication. Then we have to prepare skin and apply accessory products like stoma adhesive, par or paste. So these products are used to create a skin sealant to adhere pouching system to the skin to prevent leakaging. Then we have to apply the wafer and bag around the stoma. Position the bag to hang in a dependent position. Then we have to dispose of the soiled bag and appliance properly. Then we have to document it. So these are about the colostomy care. So steps of the colostomy care. So next we'll move into the ostomy irrigation. How we have to do the ostomy irrigation means, first we have to remove the pouch, then we have to digitate the colostomy, then we have to fit irrigation sleeve, that is a cone shaped sleeve, it is available, we have to fit that. Then we have to hang back with base at the shoulder level and ask the patient to sit on or next to toilet, and we have to ensure the water temperature, it should be there at 37 degrees Celsius, and we have to insert the lubricated cone into stoma. Then we have to run the fluid into the ball, and then after that we have to remove the cone and fold top of sleeve, then flush output down into the toilet and remove sleeve and apply cap and wash and try it. So this is about the ostomy irrigation image. Next we'll move into the ostomy diet. What type of food we needed to give. This is very important part. We have to choose and give the foods to the patient. First one is we have to avoid the food that may cause increase order, that is example eggs, fish, garlic, onions, broccoli, asparagus, that foods we should avoid it. And then food and beverages that may increase gas, that is also eggs, potato and all, we have to ask the patient to avoid it, cauliflower, like that. Then food and beverages that may thicken stools, examples cheese, buttermilk, rice, yogurt and all, we have to ask the patient to avoid it. Then we have to ask the patient to avoid food that cause loose stools, again bananas, buttermilk, cheese, peanut butters, like that food we have to ask the patient to avoid it. And we have to ask the patient to avoid the food that is high in the fiber, like broccoli and all green leafy vegetables and all. And next one is a family teaching, that is very important. So first we have to demonstrate how to clean the stoma to the caregiver, and tell the client to expect effluent daily. It will be watery initially but will thicken within 2 to 4 weeks. This teaching we have to give it, and expect excessive flatulence for 4 to 8 weeks. These things we have to teach to the family members also. So this is about the ostomy and colostomy care. Thank you.